Today we are covering the use of restraints and the absolute necessity of using alternatives first, a topic the NCLEX loves to test through prioritization and safety questions. Exam questions will not ask you for a simple definition. They will give you a clinical scenario and ask for your first best action. Imagine a 78-year-old patient with postoperative delirium who is confused and repeatedly pulling at their central line. The options might include applying wrist restraints, administering a sedative, calling the provider, and attempting to reorient the patient. The correct answer is almost always the least restrictive intervention that maintains patient safety. In this case, you would first attempt to reorient the patient and verbally de-escalate the situation. If that fails, you might try concealing the line with gauze and a sleeve, distracting the patient with television or a familiar object, or requesting a family member or sitter to stay with them. Only after you have attempted and documented the failure of these alternatives can you consider restraints. A common exam trap is choosing restraints for convenience or as a solution for understaffing, which constitutes false imprisonment and is always incorrect. The NCLEX expects you to know that restraints are a final resort to prevent harm to the patient or others, not a tool to make your job easier. When restraints are unavoidable, you must follow strict legal and safety protocols. You must obtain a provider's order. In an emergency, a licensed nurse can apply restraints, but you must obtain a written or verbal order within 1 hour. For behavioral restraints, where a patient is a danger to themselves or others, the exam will test you on specific time limits for these orders. The easiest way to remember this is the 4-2-1 rule. An order for an adult aged 18 or older is valid for 4 hours. For a child or adolescent aged 9 to 17, it's 2 hours. And for a child under 9, the order is only good for 1 hour. A new in-person evaluation by the provider is required to renew the order. It cannot be a standing or PRN order. This is a critical detail that frequently appears on the exam. Proper application and monitoring are also prime targets for test questions. You must use a quick-release knot tied to an immovable part of the bed frame, never the side rails, as they move and could cause injury. Ensure you can fit 2 fingers between the restraint and the patient's skin to prevent compromising circulation. Once restraints are on, your job has just begun. You are required to assess and document neurovascular and skin integrity checks every 1 to 2 hours. This includes checking circulation, sensation, and mobility. At these same intervals, you must provide for the patient's needs by offering fluids, nutrition, and toileting. You also need to release the restraints periodically to perform range of motion exercises. Remember this simple phrase to master the process for the exam: least restrictive first, last resort only, and monitor closely. This mental shortcut reinforces the core principles that guide all NCLEX questions on this topic. By proving you can exhaust all alternatives before correctly and safely implementing this high-risk intervention, you are demonstrating your readiness for safe nursing practice.